What are the most important medical tests or screenings people should be asking their primary care doctor about?
It's called a calcium scan. And basically, it's a CAT scan of your heart. And it can tell you if you have calcifications in the blood vessels that feed your heart. And you're supposed to have zero, like a calcium score of 0 is normal. And at the time, my score was like 400, which led me to another test, which is called a CT angiogram, where they inject dye into you and then they do that same CAT scan. But the reason I focus on these heart tests is heart disease is the #1 killer of men and women in the United States and in the world. So I would think about asking your doctor, if you're like over 40, I would say for sure, certainly over 45 or 50, for a calcium scan, which is a CAT scan on the heart. It might not be covered by insurance, but the cost is maybe $200, and it's a very valuable test. But I'd begin there because heart disease is our #1 killer. And the #2 killer in the United States and in the world, for that matter, is cancer. In addition to doing your colonoscopies and, prostate exams and pap smears and things like that, mammograms, you want to say, well, what can I do beyond this? And I'd say anyone over the age of 50, and this we know is at a higher risk of cancer, is age. You can get a full body MRI, might cost $2,000, but it'll tell you if you have a tumor anywhere or an aneurysm or something in your brain or your abdomen or your chest at an early stage where it can be treated. And then from a blood test standpoint, there's a company called Gallery, and they have a blood test, and it tests for over 50 different types of cancers that aren't routinely screened for. In other words, just because you have a colonoscopy and a prostate exam and your mammogram, that doesn't mean you don't have cancer, let's say, of your pancreas or your liver or your gallbladder. So it might cost $800 or $900, but these are worth having conversations with your primary care doctor about because, if I can rule out the #1 and #2 causes of death, that's pretty good. That improves my chances of longevity, right? But from a testing standpoint, I would start there. And then finally, I'd say maybe metabolic disease. I think a lot more people are testing for hemoglobin A1C. With the popularity of Ozempic and Wegovy, you see these commercials like, I lowered my A1C. You don't necessarily need to have a weight loss injection, but that's a blood test that's gaining popularity. And also just testing your fasting insulin. Because sometimes most doctors, they just check glucose, but your glucose can be stable for decades, but it's your resting fasting insulin that should be looked at because that is high in a lot of people, but it goes undetected for years and years. So those are just some basic tests I would, inquire with your primary care doctor about. And, I think it's important to work with your doctor and bring a lot of questions and information to the doctor.